Hello, I'm Tyler. I'm one of the students with Santa Barbara City College. Today I'll be doing a trigger, 4 views. I'm going to be doing a left lateral of the skull, an AP axial of the skull, also known as the Towns, a PA axial, also known as the Caldwell, and the SMV. I'm going to go get my patient. And there he is. Hey sir, how's it going?
Excellent.
Have you ever had an x-ray before? All right, well, it's not too bad. You just sit there, I position you, we shoot a magic beam through, and we get your picture.
Is it gonna hurt?
No, not at all. All right, can I get your first and last name?
Jared Del Real.
All right, and your date of birth?
June 9th, 1986.
Any chance of pregnancy? All right, so first thing I'm going to do is shield my patient. So, go ahead and put this around you.
Awesome.
Alright.
Very important to remember to shield your patient.
So, first one I'm going to do is I'm going to start off with the left lateral.
Especially
The patient's going to be in a LAO-ish position, but the skull is going to be totally flush with the plate. Real quick, want to go over the tube is detented horizontally and longitudinally to the x-ray tube at 40 inches. Alright, Jared, so go ahead and face the board. Move all the way as close as you can. And I'm going to get a 10 by 12. We're going to go longitudinally, landscape. Put that baby in there. I got my left marker. We're going to raise this up to about 2 inches above the EAM. That's about approximately where the central ray will go. Obviously, you do some fine tuning as you need to. Alright, Laura, we're going to go vertical. Don't think unless I tell you to. Alright, I'm just going to get you up nice and close. Alright, so main points on this one, we want the OML to be perpendicular with the edge of the plate. OML goes from the EAM to the outer canthus. So what I'm going to do here is just fine tune, tilt your head down a little, right there. We want to make sure we include the full skull. You don't want no tilt or rotation. I'm going to go ahead and put my left marker right there. Alright, so for this image you do not need to include the mandible. You want the upper incisors and include the full skull. Alright, so it's hard for them to keep still like that, so once you got them in position, make sure your marker's not in the way. And my technique's going to be 80 at 12. Hold your breath, x-ray, beep. Alright, breathe. Okay, so that's my lateral skull. I'm going to go ahead and jump over to the Caldwell. Patient, we're going to want the OML perpendicular with the IR this time. So go ahead and straighten out, Jared. We're going to switch the left marker to his left side now. Go ahead and basically forehead and nose on the board. That somehow you can, after a while, that's basically what you do. Of course, you want to make sure that he's not tilted too much. So he is just a tadly, so we're going to elevate his chin slightly. Make sure that the OML is perpendicular to the IR, as it is. Collimation already looks good. Mandible's not needed. I'm going to flip the marker and alright. That's it. Alright. We also want a 15-degree angle on the tube. And you want it to exit out the nasion. And boom. Looks good. Technique for this one, 80 at 12. Hold your breath. X-ray. Breathe. All right, Jared. We're almost done. Go ahead and flip around. You're going to face the X-ray tube this time. We're going to throw... Huh?
Alright.
All right, sir. You doing good?
Yeah.
60, 70, 80, 90, 65, 65. So I'm going to throw a 30-degree angle, caudad. Caudal. And we're going to enter at the glabella. We also want his chin to be tucked in as much as possible. Otherwise, we got to throw more of an angle on the tube. We don't want to do that. Chin's tucked. OML's nice amount. This time we're going to go plate longwise portrait. Again, central ray at the glabella, exiting out the back of the head. Patient is, oh, someone's here now. Hello, sir. Oh, that's the phone. Alright.
That's not what it looks like.
It's not what it looks like. Okay. Why isn't your head looking thick like a light? Like a dolichocephalic sucker? Alright, so Merrill says at the glabella, typically it looks like his skull is a dolichocephalic. It's longer. So we're going to have to adjust the central ray and we're going to have to go up to fit his skull in there. Huh? 30? Is it 2 now? So that looks pretty good right there. Alright. So it looks good. My technique's going to be at 80 kV with 12 mass. Okay, hold your breath. X-ray. Breathe. All right. So we got one more, Jared. This one's a little more difficult. Let me get everything ready first.
All right.
We're gonna go ahead and do the SMV.
Sorry for the interruption.
Yeah, you know. So
Messing up our trip.
all right, this one we're gonna have a perpendicular central ray. Still at 40 inches. Central ray is going to enter mid-sagittal plane of throat, exiting 3/4 of an inch anterior to the EAM, right above his hole. We want to make sure we include the full skull. We ideally want the IOML parallel with the plate. So that would be approximately from the EAM to the center of the nose, parallel, and he looks pretty good. So I'm going to go ahead and give that one a shot. Technique this time is going to be 80 at 20. We got a lot more head that we're going through. We're going to make sure that the bucky is centered, and we're set. Make sure he's not tilted, chin up. We want to make sure that the chin is superimposed with the grill. And I can collimate in a little. Give a nice pretty picture and hold there. Taking a breath. Hold. X-ray. Breathe. And relax. Bam! Alright, sir, go ahead and get changed. And that will conclude my positioning for my skull trigger. I will be going through some evaluation images, showing you guys what it looks like. And this is my happy dance.
20-minute stops.
Alright, so for the x-rays, I'll be going over what we'll be looking at to make sure that it's a good image. First off, you want to make sure that you have all your anatomy in, all the way up to the EAM. And hopefully your zygomatic process is centered. That means that you're properly centered to the IR. You want no rotation. That's demonstrated by the supraorbital roof or margin. Also the mandibular angles or the gonions. Those should be superimposed. They're not superimposed, but that's not repeatable. It's just slight rotation, no tilt. You also want to see the sella turcica in profile. And you want to make sure there's proper brightness and bony tuberculae. Make sure that your image isn't burnt out. Make sure that it's properly exposed. And this one's a good image. You can see everything in it. You see the frontal sinus, maxillary sinuses. This would be the phenoid sinus, and these would be the ethmoid sinus. And on to the next image. Okay, so in this image we have the PA axial, also known as the Colville method. For this image, you want to make sure there's proper collimation. As you can see here, we don't need the mandible in picture because that's not what we're looking at. You want to make sure there's no rotation or tilt. There'll be equal distance between the lateral borders of the skull and the lateral border of the orbits. Looks good. Mid-sagittal plane should be aligned with the long axis of the collimation field. That would be that, and mid-sagittal plane. Okay, good. You want symmetrical Petrus ridges lying on the lower third of the orbits. Lower third, Petrus ridges is this little cloudy-ish looking thing. It's what holds your, basically your air canal, your EAM. Looks like a little pyramid. Looks good. And you want to make sure that there's penetration of the frontal bone with appropriate brightness at the lateral borders of the skull, which shows the facial bones. And that looks good. Also, you can see the frontal sinuses here. These would be the ethmoid. You cannot see the phenoid bone or phenoid sinuses in this image. And maxillary sinuses are superimposed by the Petrus ridges, which that's where they should be. And this image is done erect. All these images are done erect. It's to check for fluid levels in the sinuses. These would be the supraorbital margins. And yeah, go on to the next one. Alright, so here we have the Townes method. This is the AP axial. What proper collimation. They could have did a little better job on this. You don't need the mandibles in here or the TMJs. Also, I want to make a correction. I stated that the central ray is angled at and enters at the glabella, and then I had to I had to fix it and go up a little higher. But that's the reason why I had trouble, because it's actually 2.5 inches above the glabella, and so that's basically what I ended up doing. So that's why I had trouble fitting the skull in there. But back to the evaluation criteria. The entire cranium without rotation and tilt should be demonstrated by equal distance from the lateral borders of the skull and lateral margins of the foramen magnum. As you can see here, this is the foramen magnum, lateral borders. Looks pretty good to me. You want symmetrical Petrus ridges. This cloudy stuff like you've seen before in other images. These are the Petrus ridges. It's like a little pyramid forming. That's good. Mid-sagittal plane should be aligned with the axis of the collimation field. Looks good. Dorsum sella and the posterior clinoid process should be visible in the foramen magnum. And that's actually a pretty good picture right there. A little rectangular. It's a dorsum sella. And you want some nice penetration of the occipital bone with appropriate brightness of the lateral borders of the skull. That way you can see the petrous ridges. You can see here a suture. And yeah, this image is pretty good. Alright, so here we have the SMV image. This looks like some good proper collimation. We want to make sure that we have all anatomy up, or well, back to the magnum foramen. This here would be the trachea. This would be the phenoid sinus. These are the zygomatic processes, your cheekbones. These are your incisors. And we want to make sure that the zygomatic arches are free of overlaying structures, which they are. No rotation or tilt. This is demonstrated by zygomatic arches symmetrical without any foreshortening. They look good. And obviously brightness and contrast demonstrated soft tissue. And bony trabeculae detail. They also want to check for any fractures of the cheekbones. These look pretty good. There's no indentations. They all looked nice and symmetrical. And this foot here, I believe this is the maxillary sinus and ethmoid sinus.